Good morning, everyone. How was everyone doing? This is a chamber event, so play along with me. Good morning, everyone.
Good morning.
There we go. All right. Like that. I also want to join Melina in thanking the Virginia Chamber for putting on this great event. We were just talking earlier. It's just a really high-quality event, and if you see some folks from the Chamber during one of the breakout sessions, be sure to shake their hand and thank them for putting on a great event. Want to welcome you to this discussion on consumerism and generational challenges. I think this is going to be a really interesting session. And before we get started, I'd like to have the panelists each introducing themselves, and we'll start here to my immediate left.
Sure. Hi, everyone. My name is Carrie Nixon, and I'm the founder of Nixon Law Group, which is a boutique healthcare law firm with offices in Tyson's Corner and Richmond. I'm also the CEO of Healthcare Solutions Connection, which is a network of experts in the healthcare industry, and our goal is to help our provider clients really navigate healthcare reform and position themselves for success over the next several years.
Good morning. My name is Steve Morgan. I'm the Chief Medical Information Officer for Curling Clinic, and it's a pleasure to be here. Curling Clinic is, I hope a lot of you know, and if not, we're a healthcare system, not-for-profit in Southwest Virginia with 9 hospitals, 220 ambulatory sites, and about over 700 physicians. We have been actively involved in this area in particular with some research that we're doing with Virginia Tech and have actively been looking at consumerism in healthcare and are really looking forward to this conversation.
Great. Hi, everybody. I'm so glad you're here today. My name is Paige Clay. I'm a partner at Mercer, and I run our offices here in Virginia. We have 2 offices, one in Richmond and one in Norfolk. We are a global human resources consulting firm, and we really our mission is to advance the health, wealth, and careers of all people. And I'm very proud to be here today, and I thank the Chamber for asking me to be on the panel. Really excited to talk about these topics. The healthcare workforce is a really large concern for me, and we have a healthcare practice. We work with a lot of with a lot of our clients who are either have healthcare systems. And so I'm excited to kind of get into the conversation and talk about what our challenges are and how we can all work together and pull together to start to solve some of them.
Well, good morning, everyone. I'm Marco Sidi-Garay with VCU Health, and I'm delighted to be here and actually quite honored to be on the stage here with my fellow panelists. And I'm with VCU Health. Those of you, it's the evolution of MCV. Yes, I said MCV. VCU Health is the combination of the VCU Health System care delivery elements, also the health sciences schools, of which there are 5 at VCU, and the research and elements that go on around discovering new knowledge. VCU Health in the rebranding or the branding of VCU Health is meant to recognize that VCU Health is also one of the largest Medicaid HMOs in the Commonwealth, serving the Commonwealth. It is also a partnership with Inova, with a medical school on that campus. It is also a partnership with UVA with a pharmacy program. So again, it's exciting to be here. It's exciting to be with VCU Health all the years I have, and I'm looking forward to the conversation. Thank you.
So we got a great group of panelists here and a really kind of a meaty topic. And I'll start it off first by saying I just got back from a 2-day conference in Atlanta. That was a marketing conference, and it was specifically on content development and mostly around brand journalism and social media development, social media content development. And I've got to tell you, I was easily one of the oldest people in that room. And it was our business, like most industries, is filled with millennials, and millennials are really driving that discussion. And it's always an interesting topic. It certainly has an effect in healthcare. So I'll start off by talking about the fact that one of the things I've seen, and we saw it at this conference I was at, is millennials are all about instant gratification. And they're a generation that's based on that. And so they approach healthcare with very different expectations and skill sets than prior generations. So with that in mind, how would you say that the everyday use of technology has shaped that generation's expectations when it comes to healthcare?
So I think millennials are actually pretty frustrated when it comes to healthcare because they are used to instant gratification. They're used to instant communication. They're used to picking up their phone when they want to connect with someone, texting that person, and having that person text right back to them. They're used to an on-demand mindset where if they've missed their favorite TV program, they can just go on demand and get it and pick it up, or they can, they want a new piece of music or a new book, they can just download it and put it on their Kindle. The healthcare system is completely different, and they kind of scratch their heads, I think, and go, how come I have to wait so long, or how come I have such a difficult time engaging with my healthcare provider? Forget texting them. I can't even send them like a regular email to ask them what's going on. And forget on demand. Why do I have to go into an office setting when really just a quick FaceTime, consultation would suffice? I'm simplifying it. We from the healthcare sector know that things aren't as easy as that, right? You can't just necessarily send a text message to a provider with patient health information, right? That's a problem. But I think it is how the millennials view it. They wonder why they go into a doctor's office and they are handed a packet of forms that they have to fill out by hand with a pen and paper with the same information every single time, date of birth, and this is their doctor, right? What drug allergies do you have? Like, don't you already know? You've been treating me forever. Why am I having to re-enter this information? So, I sense frustration from that generation a little bit, and I think as we move forward, that frustration is really going to drive some change in the way that healthcare interacts. It's going to have to, right? Because right now, maybe millennials aren't really the generation that hold a lot of the reins of power, but they're definitely moving that way, and I don't think they're not going to tolerate it. So they're going to drive some change.
Well, millennials are the eye candy, right, of generations, but they're certainly only one segment of healthcare system's primary audience. So this whole rise of consumerism that we're talking about here, there's a number of generations that are seeking healthcare, and they all have very, very different needs. So how do healthcare providers need to shift then their delivery models to meet these needs of the generations?
So I feel like there's a couple big things there. Ease of entry, which I think Carrie mentioned a little bit, is key, but through multi-channels. So while we talk a lot about millennials, right now 35% of the workforce is millennials on average in the US, which is pretty scary, 34 years of age and below. But there's all kinds of other generations. So we're getting ready to have basically 5 generations that are buying. And so what does that mean to healthcare? That means that, well, let me give you an example, which Dan I thought was going to take from me earlier, but he really didn't take. It's a financial service example. So think about 25 years ago when you needed money, you went into a branch bank. Then about, 15, 20 years ago, you could go to an ATM to get money. Then there was bill pay. Now you can scan your check on your phone. Have any of those channels gone away? No, they're all still there. But if you go into a branch now, are there any people in the bank? Not that many, right? Okay, so it's a shift. It's the same thing in healthcare. We, all of us, have to learn how to deal with those 5 generations, how to meet them where they are, how to help them with ease of use, and how to have multi-channel access. And same thing with communication. You have to have push and pull communication. You can't just, let's go back to millennials, 34 and below. They naturally, automatically will research anything. So if you do not have transparency and let them have an easy way to research things, they're going to be frustrated because that's what they do. That's what they've been taught to do. And Carrie made some great points, but I think if you go back to, you have 5 generations you've got to deal with. They all want to interact with you in a different way, in a different place. And I think healthcare systems have to think about the entry point. So whether you call them patients or customers or whatever you call them, but when they come in, how do they come in? How do they move through your system? And we're working with a lot of healthcare clients on this. one of our sister companies is, which is, how do you come in and find all the touch points all the way through your system, and how do you brand yourself in a way to care for all 5 of those generations?
Interesting. So why is it that there's been a greater focus on consumerism in healthcare? I mean, is it just a generational issue, or is this something that's a larger issue here at play?
I think it is a larger issue because, healthcare systems in patients, healthcare system realize patients are spending a lot more for their care, and for that they become savvier at being consumers. They're either in a lot of cases, depending, are looking to either research care, which some are doing. Some are just not seeking care. Some are just, which is a problem if you're doing population health and trying to be able to close gaps. So, and then you've got a group that are actually seeking care but not able to pay for it. And with a large portion of uninsured, that can become an issue. So it's become more of a focus, particularly for the ones that are looking to shop and that are looking to get a better value for their health care. Healthcare systems also, there's a lot of competition in the marketplace now. So they're competing not only to keep patients engaged and have great patient experience, but they're also wanting to make sure that the patients that they have, that there's the stickiness factor and that you're keeping those patients. And so there's a lot more focus with marketing and consumerism from healthcare systems. And there's financial incentives. So if you look at something that I would bet probably 5 years ago, most physicians wouldn't have recognized the term CG caps or H caps. Well, now they become part of what physicians understand, that they have to pay attention to what the patient experience is all about, because CMS is now, basically has either penalties or rewards depending on how you do in those programs.
So one of the things that we've talked about here is multiple generations. They have multiple touch points, as Paige was talking about. But let's talk about some of the potential pitfalls or consequences about making some very broad generalizations about these different groups, the Gen Xers and the millennials and such.
Todd, thanks for bringing that up, because as I've been listening to the conversation here, there is this tendency to sort of migrate to putting broader, maybe simplified categories. And while they're necessary at times, and I think they do serve a purpose, they're unintended consequences. I think, yes, millennials tend to be characterized as wanting things on demand. I have 3 millennial sons at home, so I know, I live that. Sometimes I have to text them when dinner's ready and they just happen to be upstairs. So I get it. Yeah. But that whole notion of instant gratification, I mean, millennials didn't invent fast food or drive-through windows. So those are characteristics that you could associate with any generation. They're individuals that would want to have something on demand. That is a characteristic that, so I think if you make those broad generalizations, you may lose sight of other drivers of consumption that may be economic driven, that are more important in viewing if your desired outcome is to have the appropriate level of healthcare consumption and not an overconsumption. The other is the notion of, and this is who is it? Clayton Christensen, the writer of What's Coming Next or Seeing What's Next, his book. And he describes consumers as non-consumers or overshot consumers or undershot consumers, and those broad categories too. But when you think about it in healthcare, you have people that are non-consumers, and those could be the ones that don't have the means to consume, or if they do it very late because they can't afford it and they're in the emergency room. You have overshot consumers who are ones that are probably most folks where they just want the basic diagnostic on their phone. They don't want to have to go through all the other expense. And then you have some that are undershot that will want to buy up. They'll want the concierge medicine. They'll want those. So I think we have to then look at consumers in different ways and understanding that there are some generational aspects that are important.
Interesting. Any other, this is a big topic, we were talking about this earlier. I don't know if there are any other pitfalls or unintended consequences perhaps of making broad generalizations.
Well, I think we're also running into the age where people, patients or consumers come with help. So like for me, I might have an ailing parent, and then I choose to go along and help navigate the system. So we were talking before that consumers are getting more assertive and they want answers. And so if you don't have transparency that you can pull down, and you're not getting transparency from either your physician or your caretaker, then there is a lot more push to get that. And so the question becomes, do our healthcare providers and workers, do they have the skills to handle that? I think there's a real issue with skill change. I mean, technology alone is going to create all kinds of needs to change skills, but if you look at the next 8 to 10 years, by 2025, 50% of the skills will be not needed anymore in the healthcare arena. So a shift of 50% in 8 to 10 years of skill sets, I think, is just a huge burden for everybody, the globe, to have to handle. And so it's going to take a lot of interventions and a lot of disruption to make that happen.
Well, in addition to the 50% that you have, basically maybe moving out, there's probably another group that's coming in of skills that we're not, from a provider standpoint, that we're not quite ready for. One of the things that we have seen is not only with technology causing issues, but with this push is really a lot of provider burnout, because we're having difficulty handling both the regulations, trying to figure out this consumer thing. I mean, why am I now starting to be graded because of patient experience? Why is that important? There was a recent Mayo Clinic study that showed from 2011 to 2014 a significant rise in physicians that are reporting burnout, and then that their work-life balance. So it is something we need to pay attention to as we're adding more pressure to the system, and consumerism certainly has the potential to do that.
And we've kind of gone from a time where the word of a doctor was not questioned by patients, right? And I think our aging population is many times sort of still in that space where when their doctor tells them something, they're not going to question it. But to Paige's point, when their child comes with them and has access to, says, I've been looking on the internet and the doctor says this, and then the daughter says, that's not what I read, or I don't know if that's actually really good for my mom. I mean, that's a real change and a shift that we're seeing too. And again, I think that's hard for some doctors to know how to react to.
It's almost a rub-off too, because you're almost seeing the millennial rub-off to some degree to the parent, or to where you have to kind of deal with that. Kind of the adage that I think is really now more apparent is that rather than you're my patient, I'm your doctor, and that change in relationship.
One of the other kind of a consequence is the fact that because we've seen so much overconsumption, that overconsumption has been largely responsible and has been written about as attributed to the high cost of healthcare. So then the question becomes, so how do healthcare providers balance this drive of healthcare consumerism with the need to de-escalate or unwind some of the consumption in order to bring down spending? So there's a balance there. So how is that happening?
Well, is there an economist in the house? I mean, that's a tough question.
Yeah.
Because by nature, the word consumerism is about consuming products or services. I think the balance is that it's not just the consumption of per unit service, but also the number of units that are being consumed and what types of settings. So I think with healthcare providers, it's understanding that guiding the consumer or patient and consuming the right kinds of care earlier on, or the right kinds of services, so that logically it then has a good chance of preventing more expensive types of consumption on down the line. But also realizing that not everybody's going to necessarily follow that. It gets back into the engagement of the consumer that was talked about earlier as being critical by the previous panel and by the keynote addressers. So yeah, it is an interesting dynamic there, in that part of the industry drive is we need consumption, but at the same time, what types of consumption and what are the long-term effects of of that.
So it's somewhat of a targeting approach there.
Yeah, I think so. I think so. I mean, consumers by and large are barraged by a variety of media that either encourage certain types of behaviors or consumption of certain types of products. And I think that navigating through that as healthcare providers and providing that guidance and that information, whether it's through a medical home or some other connection you have with that patient, so that they are consuming or those services that are most beneficial to them, and foreseeing something that could be quite catastrophic or expensive down the line.
Let's do this. Let's shift to another topic, and one that I think may be on the minds of a number of folks here, and we've certainly been touching on, and that's technology. And what do you think that the role that healthcare technology plays in not only the millennials, but also the aging population as well? What is the role of technology there?
So it might be a little bit counterintuitive, right? Because I think of my mother-in-law and the 3 hours over the holiday that I spent untangling the mess that she had created on her computer. And you kind of automatically think, well, seniors aren't necessarily tech savvy, right? And they're not very comfortable with technology, so maybe healthcare technology doesn't really apply to them. But I think that's actually far from the case. We will rapidly be approaching a time when the capacity of our healthcare facilities, our assisted living facilities, our senior living facilities, is not going to meet what would be the demand, right, of our aging population. The baby boomers are entering sort of that age group. And so what do we do when there aren't, senior living facilities or assisted living facilities, enough to go around to accommodate that population? Well, the good news is that we can do a lot. We can actually help them age at home, right? And healthcare technology is a huge part of that. I work with an incubator called Aging 2.0, and they incubate startup companies that are focusing specifically in healthcare technology for the aging population. And there are some amazing things out there. There are some very inobtrusive monitoring type devices that can be placed in the home that use sound, patterns, and recognition and predictive analytics to understand the patterns of behavior of the inhabitants of that home. So, are they generally in the kitchen getting breakfast at this time? What time are they? Are they generally taking a nap at this point in the afternoon? What time are they generally winding down to go to bed? And are they sleeping well at night or not? And they can, develop a predictive algorithm and recognize when something is off with the pattern. And then they can trigger a family member, right? They can send an alert to a family member. That is just one example of the many, many technologies that are evolving to serve our aging population. One thing quickly I want to address, though, is that one thing we also have to consider is that there are socioeconomic impacts as to who can necessarily have access to those kinds of technologies as well. And that's something that I think we really need to focus on as our population ages.
Interesting. Any other thoughts on technology and its impact on different generations or specifically the aging population?
Well, I think, again, the technology with the aging population and sort of assisting and understanding when an alert happens. I can think, for me, a family member at Christmas, the alarm kept going off and I was getting calls from ADT that the ambulance was going to the home, and they were saying, well, how is she doing? Well, she's standing right beside me here. There's obviously something faulty going on in the home. So to be able to have the additional technology to say, well, that's a false alarm. I mean, that's just sort of, well, it's two things. One, sometimes the technology can be faulty. You got to be mindful of that. But at the other time, is there technology that can help go a little bit deeper into understanding what's going on and whether it's something that's a crisis or whether or not it is. The other is for those complex patients that have complex conditions that we know broadly in healthcare that a certain segment, whether it's an 80-20, 20% of the population is of some morbidity, complexity, consume 80% of the healthcare spend in this country, are there tools, technological, that allow us to monitor them more closely so that we can be predictive to the degree we can, but intervene in a way when things are beginning to go in a direction that will be harmful or, in some cases, costly, both in life and in expense for the individual. So I think technology does have its use.
I want to pick up on something you said, though, and I think it was also mentioned by Paige and Carrie, and that's this issue of the surrogate healthcare consumer or the caregiver, those entrusted with making the decisions. How do we manage those roles in our system?
Well, we mentioned doing it or helping out the aging, the older population. And for some of us, we're kind of sandwiched in that we have a younger generation where we're doing the same sort of surrogate type of consumption, I guess, in a way, and that we're guiding those decisions. And I think that as providers or just broadly in industry, how do we understand that there isn't just an individual who's making a decision? There may be others that you have to be in touch with to influence those correct behaviors that you want.
So shift gears again to workforce, and Paige, I know that you and I were talking about workforce earlier, and Carrie as well. We're going to see some significant changes in the workforce of healthcare providers healthcare workers over the next 10 years or so. What would you think would be the impact to consumer as we're talking about maybe advances in technology due to some of that change that's going to be happening in the workforce over the next several years? What's going to be the new healthcare technologies as we shift from fee-for-service to value-based and outcomes-oriented models?
So, I like to think about some of the macro trends. By 2025, we're going to have a lack of new talent in this marketplace. If you think about healthcare, and if any of you guys have kids who are in high school and thinking about their careers, here's the one to go for. A third of U.S. job growth in the next 10 years by 2025 is going to come from the healthcare industry. Specifically, and I think Carrie mentioned this earlier, outpatient care centers, that's going to account for 400,000 new jobs. Home health care services, 700,000 new jobs. And, this is multifaceted in the skills that are needed across this. And so this is where I think people need to pull together. I don't know that we're getting enough of the supply from our universities, from our colleges. I know this is on the governor's, workforce plan. But we need universities, we need community colleges, we need large corporations digging down and working. And I know, since you gave me a hard time, I'm going to go, I know my buddy Bill Ermatinger and Huntington Ingalls, they've reached into the school systems. We have to be doing things differently or we're not going to solve the supply problem. We are going to be short 260,000 nurses in 2025. And if we don't work together, granted, we're going to have great opportunities to work at the top of your license. If you think about technology, the skills that every single employee in the healthcare services industry, they will need high-end technology skills. This was my point I made earlier. 50% of the skills that our healthcare providers have today will be gone. Those skills will be gone and they will need new ones. So if we aren't shifting what we do and how we do it, we're not going to have enough. We're going to have a shortage of skilled IT staff. We're going to have a shortage of clinicians. We're going to have turnover because it's going to be a bit of, hey, I'm going to raise my price here. I'm going to raise how I pay you. It's a big issue. And if you think about us, we're all aging. Who's going to take care of us? Seriously. Come on. So any of you who have children, this is called, they're going to have a job in the future. So think about how you pull together. We need to collaborate. We need to partner. We need big corporations. We need universities. We need the government. We got to all pull together because this is scary. very scary.
Paige, you're absolutely right, and you know, I'm looking at Steve also at Carillion, academic institution, providing medical, but also nursing and other allied health professionals, just like VCU and other of the health systems, and in Virginia, needing to be partners and developing programs like we have at VCU, one called Jump Ropes to Stethoscopes, that is a pipeline program that reaches deep into those years, even before high school into middle school, when those foundations can be cultivated so that you then have that pipeline. Will the pipeline be big enough? I don't know. And that's where I think technology, we got to think where that can enable folks to allow their talents to be spread across a larger population. The other thing I was thinking, I wanted Steve to comment on this in your medical training, is a medical student enters now, 4 years after they go into a residency, at least 3 years, maybe longer, nearly a decade. And what transpires across that decade, both in technology and consumerism behaviors, how to educate that population. And it isn't just medical students, it's all students, so that they're ready as soon as they enter the workforce formally.
And that's, Mark, is an excellent point, because trying to make sure, and a lot of, as you say, residents and fellows, by the time they have finished, the technology has changed. And it really has to start at a student level to be able to train and then go back and retrain and then look at the market trends, because it's changing so rapidly. And it's frustrating, I know from talking to some of our residents. I mean, it really does change that quickly just since they were a student.
And then you have the existing providers.
Yeah,
that are
you've got to
faculty,
train.
but all those that have to get up to speed quickly. And so where do we supplement their education throughout their career to enable them to be savvy in consumerism or technology?
I do agree with you, though, because I don't think we're going to bring enough providers nursing to the marketplace. We have to find better ways and different methods of treating patients and being able to find more efficiency. And it's going to be a challenge, because in whether that's telemedicine, whether it's using advanced care practitioners, we really are going to have to look closely at that, because I'm not convinced we're going to get enough to the marketplace to be able to meet all the needs.
So expand on that. So how was your health system then prepared for this rise in consumerism, prepared for these changes?
Well, in addition to the education, because we have a similar program and really trying to get starting at a student level, as you're describing, Marcos, but a lot of the things that we have done and made investments in, and no different than VCU or any other health system, is really in the technology to support the consumerism, whether that's through a patient portal, doing more data collection and doing more mining of data to understand patients better, to understand how you can do more outreach. A lot has been done around education with providers, not just around the technology, but really, again, as I was saying earlier, around the consumerism aspect and why that's important. And the other things, and we've kind of touched on it in several times, is really the transparency issue with data and transparency to the consumer with data. We right now have on our patient portal about 120,000 patients that are actively using a portal. One of the other things that we have done has just recently we participated with with Virginia Tech and IBM on a hackathon to look for apps. So trying to develop more consumer-based apps, healthcare apps, are just some of the ways that we've been trying to stay ahead of this game.
That's fantastic. I love the hackathon idea. So preparation's important. Education's important. How are we educating our healthcare providers and helping them build these competencies that's going to address these trends that we've talked about here on this panel discussion? And then how are we going to educate the future practitioners and the students coming into the system as well? What are we doing there?
Well, we're touching on that in the previous conversation, but to sort of dive in a little bit further, and it isn't just VCU, it's also Carillion, UVA, and EVMS, and other, is the use of simulation to build those skills and competencies at a technical level. But there's an opportunity, I think, there to introduce the technologies that will enable them so that they, again, can integrate the information that's flowing in various pathways that they can then interpret it quickly and make an actionable decision on how to proceed. I think that for the existing providers across professions, it's the continuing education that I think can come as a part of the academic enterprise, but it can also be associated with other. The key is to get folks competent at existing practitioners and those that are learners today.
And part of that as well is really helping providers to understand how technology interplays with the shift from volume to value, right? Patient engagement is an enormous part of accountable care, right? And we hear a lot about accountable care, and we hear a lot more now about, patients taking more responsibility for their own care. And technology is allowing that. It's allowing them some insights into their care that they didn't really have before. Providers also need to understand that technology is providing them with lower cost settings. So, telehealth visits, and we've got to improve reimbursement capacity for that. But, technology allowing patients to move from a skilled nursing facility rehabilitation to home care, as you mentioned, more quickly. Because of some of the technology capacities that are there. So we need also to educate physicians about, how all of this plays into how they are now getting reimbursed.
Yeah, Gary, if I could jump in real quick.
Yep.
This came up a couple weeks ago, Steve, at another conference. Is we have all this bombardment of technology and capabilities now. How do we make sure we don't lose the human elements?
Yep.
And you were just touching
Yeah.
on the need for the labor force out there. I mean, it's not going to change too dramatically like the banks. You can still go to a bank if you want, but folks are going to want to see people at times. And so how do we make sure that the students are getting that interpersonal skill set, the emotional intelligence, if you need, in healthcare also?
We're almost out of time here, so have a lightning round question. As Marcos and I were joking earlier, this is kind of like the version of wait, don't tell me. So the lightning round question, you'll each have a few seconds to respond to this, and we'll start with Marcos. But the question is, looking down the road 10 years from now, what do you expect will be the biggest change from today in how we access or consume healthcare?
20 seconds to predict 10 years. Okay. I think, 10 years ago, let me get it out of my pocket here, this device, almost 10 years ago, it hit the market. This is, iPhone. And it served a platform that didn't really exist before. And that's been transformative. But at the same time, you still have hospitals, and you still have clinics, and you still have all those other delivery points. So I think what you're going to see is more of a shift in these platforms rather than disappearance, so disruptive out there in healthcare, is more what you're going to see is the use of platforms, not necessarily pipelines of various, you go to this place first, that place second. You're going to have entry points into, as a consumer, into the healthcare delivery in different ways now through platforms.
And bigger iPhones, too.
Bigger iPhones, yeah.
How big are they going to get?
So I was going to say a similar thing, but since Marcos got it, I'm going to shift that. So what becomes the role of the employer then? What becomes the role of the government? You're seeing that move, and so thinking about how did they leverage consumerism and technology to help us lower our cost and make things transparent and have people go to the right channel, and if the right channel for them is some kind of visual, medicine like a teledoc or telemedicine or whatever, then, how do they help shift the behavior change of their employees to keep their claims costs down so that they can grow in other ways?
Great. Steve?
I think you're going to see more, and this kind of goes to the speakers this morning, more individualized care. And I think personal health records will probably take over EMRs, meaning that it'll be your data because you'll be collecting it on wearables. You'll be able to collect it from different avenues, and you'll be sharing that with your provider. Genomics, I think, is going to be huge in probably moving that forward. But it's going to really, I think we're going to be shifting more to the individual patient to be able to be the keeper of their records.
Carrie?
So I'll keep it super simple and super optimistic. I think it's going to be instant access, anytime, any place, to your own health information, and the ability to share that health information with any provider that you need to share it with to give them a full and comprehensive picture of your health needs.
It's great.
This is for my fellow panelists here, but just to be a little bit provocative, is there a black swan out there? Because when you make projections, you're kind of going from point now and what's been in the past. And it could be a good black swan or a bad black swan. I mean, it could be that there in 10 years there is a cure for cancer or something like that, which is change. Or it could be that there could be a pathogen that emerges. So how do we need to be organizing ourselves as a society and ready for those kinds of, any thoughts on that? Something so disruptive that comes out of left field.
The personalized medicine stuff is wonderful, wonderful, but it can be, there's some dangers in the way that it can be used.
I think you have to.
I think those are the
right.
things, unintended
Consequences, yeah.
Yeah.
Talk
You
about
could do a whole conference around this.
Yeah.
And I want to thank the panelists here. This has been a pretty meaty topic. I think you could do a whole conference on that. So give it up to the panelists here.